So there are some complications with the BTCA that you have to know. The patient maybe will have dissection, the patient may will have, vasospasm, the patient may will have myocardial infarction, the patient will have dysarrhythmia and cardiac arrest. So normally when you send the patient to the lab, you will explain to the doctor or the physician will explain to the patient, the complication of this procedure, and it is rare. Sometimes the patient may develop, dysarrhythmia and cardiac arrest, or myocardial infarction during that procedure. So it's very important to know the complication, monitor the complication for this patient. So post procedure care, it's very important to know and monitor for the sign of the bleeding. Why? Because the patient receive anticoagulant during the surgery and after the surgery, and check for activated blood clotting time. It's very important to check the coagulation profile and remove the sheet after the hemostasis. So it's very important to remove the tissue that put in the place of the procedure has been, in the place of the wire has been inserted to after the patient maintain homeostasis, and normally it will be removed after 24 hours. Apply cardiac pressure after removal of the sheet, and patient will be positioned in the flat in the bed, and keep the patient affected limb straight. So it's very important to know some of these nursing care for this patient. Also post care for the patient, some patient maybe need to receive IV atropine. So for example, this one, why? Because the patient, in case the patient has vasovagal response, the patient may develop hypotension and slow heart rate because of the vasovagal responses. Apply pressure dressing over the area of the sheet removal. It's very important to apply pressure to stop the bleeding, because the patient will be high risk for the bleeding. And 1 day after the remove of the dressing, after remove the dressing and watch for the bleeding. It's very important, after the procedure, one of the major things that the nurse has to monitor is the sign and symptom of the bleeding after the insertion of the stent. Now we'll talk another procedure, which is coronary artery bypass graft. So it's the coronary artery bypass graft. It's very important to know about this procedure, that it's sometimes the patient will need to do this complicated procedure. So under general anesthesia, and they will open the sternum and connect the patient to the cardiopulmonary bypass machine, and this one blood vessels from other part of the body. For example, we unable to open the occlusion. In this case, we have to remove it. We have to replace the coronary artery with another one. So they will use saphenous vein or internal memory artery, and they will connect it to the distal part of the coronary lesion by passing the obstruction. You will see that one in the picture, how we are using these arteries, these arteries or vein, and connected to supply the location of the occlusion. So then the patient will be in the machine, and will be disconnected, and chest tube will be the patient incision will be closed, and the patient will be, after the procedure, the patient will be admitted to the critical care unit. It's very complicated procedure. You don't need to know so much information about it, but you have to know that the patient will be in the cardiopulmonary bypass machine. The patient will be they will replace the coronary artery with the saphenous vein or left internal memory artery. And what you have to know also, the patient after the procedure, they will transfer to the critical care unit until the patient maybe will be intubated, for example, for 1 day or 2 days, until the patient return to homeostasis. And after that, they will be they will remove the they will be extubated, and after that the patient will be fine. Sometimes they take 1 week to return to the his normal to be discharged from the hospital. This is some of the procedure how we do it. So for example, here if you see, this is the occlusion. So what we did, we put the artery to supply the myocardial infarction, to supply the myocardial infarction here from by internal. For example, this is the internal memory artery graft, and this is another one. For example, this is the occlusion here, and we use saphenous vein. So we take we are going distal to the occlusion to supply the area after the occlusion. Here, this is the similar. It is repeated things, and you can go and watch. This is YouTube link, and you will find a lot, explaining also some of the detailed information. It's after the CABG. You have some of the nursing management, pre-operative management. For example, assess the patient for any, patient for any major surgery. You have to assess the patient. Physical. You have to do physical examination. Cardiac assessment, and you have to reassure the patient to reduce the anxiety, and you have to monitor and managing potential complication about these procedures, like you have to explain to the patient, providing teaching such as exercise, lung exercise, and this is very important before the because the patient will need this after the the surgery, and monitoring and managing potential complications such as dysarthmias, like or the patient may will have dysarthmias and after the procedure, or they will have short of a breath or whatever, pain, and all of these complications. So intraoperative management, for example, you have to know the intraoperative management, the patient responsible for comfort and safety of the patient. You have to make sure the patient in safety, and this is the patient also monitor for the low cardiac output, myocardial stroke, embolism, organ failure, shock. All of these could be complication the patient develop during the procedure or after the procedure, and it's very important to know these things, because the patient may will have occlusions and may will have dysarthmias during these procedures. And whatever, also you have post-operative nursing management, hemodynamic monitoring. It's very important that patient will transfer to the ICU, and we will monitor the patient for the hemodynamic monitoring, and we make sure the blood pressures is, the heart rate, the ECG is normal. After the stable cardiac and respiratory status, patient able to breathe, will be shifting to the post-operative units, and assess for the level of the responsive pupil size, reaction. All of these assessment we have to assess, and also we assess to heart sound, rhythms. We want to check the cardiac output, oxygen saturation. We want to make sure the patient did not have any complication. And post-operative nursing management also, we have to assess for the chest movement, breathing sound, ventilator setting, because patient will be intubated, all of these things, it is ICU things. For example, we assess the patient for the ABG. So why we need to assess all of this? Because we need to make sure the patient hemodynamically stable. So because of that, we assess, because the patient, has been disconnect, the patient has been in the machine, and the cardiopulmonary machine, and we want to, and we now with the heart, we return patient back to the heart to start his function. So because of that, we want to make sure the patient is returning the hemostasis. Assess for peripheral pulses, because we don't want to patient have hypovolemia or some things, and we want to make sure the patient is high. So monitor for the pain, chest tube, IV line, oxygen monitor, and ventilators. All of these are repeated. And nursing management. After the patient return the consciousness, a certain, for example, you have to, reassure the patient, monitor for complication like bleeding, cardiac tamponade. It's very important to know what are the cardiac tamponade. It's accumulation of the, fluid in the precardial space, and fluid overload, hypothermia, because sometimes the patient will be hypothermic, because during the procedure they put the patient in hypothermia, and because of that, maybe patient is hypothermic and hypertension, dysarthmias. The patient maybe will have bradycardia. All of these signs and symptoms you have to check with the patient, after the surgery. And also in the nursing management, restoring cardiac output. It's very important. Our aim to restore cardiac output. The heart will function normally, promoting adequate gas exchange. We make sure that ABG is normal. Monitoring fluid and electrolyte balance. The patient return the kidney function is returned to normal. We don't want after the procedure has developed renal failure or something. So we don't want the patient to have a pain. And maintaining adequate tissue perfusion. We want to make sure the patient have tissue perfusion and body temperature return to normal. This is some of the nursing diagnosis. You can read it from the book. You will have, some of these nursing diagnoses and chart 27 and chapter 13. So you will have, this is some of the nursing diagnosis. That patient will have decreased cardiac output related to the blood loss and compromised myocardial function. As I explained, this is the procedure. The patient may will have, hypovolemia. They will have loose blood during the procedure, impaired gas exchange related to the chest surgery, risk for imbalance fluid volume and electrolyte imbalance. The patient may will have disturbed sensory perception related to the excessive environmental stimulation. The patient may will have risk for ineffective renal perfusion, the deficit knowledge, and all of these nursing diagnoses you have to know. This is with these patients. And thank you for listening to this lecture, and I hope you understand. If you have any question, just email me, and thank you.